Thank you very much, Danielle. And the next speaker is a colleague, a collaborator, and a friend, Stuart Flint. He's Associate Professor of the Psychology of Obesity at the University of Leeds, and he will speak about stigma of obesity in the media, which is going to be very interesting, also in the workplace. Stuart.
Okay, good morning everybody here and of course online. It's great to be part of the event, and as Francesco's alluded to, I'll talk to, of course, stigma in relation to media, but also the workplace. But what I really want to do is challenge you to think about how and in what ways we might be able to make some great strides in reducing weight stigma. That, of course, is our key challenge right now. Over the last couple of decades, I would say we've achieved a lot in the space of weight stigma, but what we haven't necessarily done is seen a dramatic shift in weight stigma attitudes. And actually within that time period, there are reports that would suggest that either weight stigma has maintained despite stigmas towards different physical characteristics, disabilities, even health conditions reducing within that time frame. And there are also some reports that in some instances weight stigma has increased over time. So I think that's our key challenge, and is a key challenge that we've set out as part of the international consensus statement that, of course, Francesco's alluded to. So starting with the media, and I refer to media portrayal as insidious, and that is because ultimately it's consistent, it's continuous, it's readily available. It's become even more readily available, of course, as the social media boom that we've seen over the last decade or so. But the messaging that we ultimately receive is widespread. And it has a great impact on us, and whether we know it and whether we like it or not, we probably are quite it's probably quite unconscious for many of us. We're exposed to this media messaging continuously daily. If you speak to people living with obesity and they talk about stigmatizing experiences, they'll of course tell you that they experience stigma on a daily basis, but those of us across the population are actually exposed, and therefore we may well be taking on stigmas whether we like it or not, and we may well actually hold stigmatizing views, because again, it's that continuous, consistent nature of stigma that we're exposed to. And media, of course, is that key source. You'll see there, and I've iterated this slide over years. I'm adding research to it as it kind of comes out as such. But really what we've seen is that some of those key stereotypes that are in the background of stigma, that often link to the sins and immorality, immoral judgments or values of gluttony and slothfulness, are very evident within media that's directed towards young people. And I'm not going to spend time on it, but just in terms of the question that was asked before, of course, that links back to Protestant values and so on. So religion is actually a key part of the development of stigma towards obesity. I would presume likewise relating to diabetes as well. But media portrayal from a very early age, aged 3, researchers identified that children at that age are reporting stigmas. It should be no surprise, therefore, that the media that is directed towards children at that age actually has those stereotypes of slothfulness and gluttony. We also know that children at that age are also reporting body image concerns and so forth. So it is a key age and kind of development phase that children are going through. And the reason that I've added information to this and why I think this is an important slide as such is because of the potential impact here. And when we talk to whether it's children, young people, or even adults who reflect on their stigmatizing experiences, and they talk about the trauma that's associated with stigma, they often talk to those experiences of stigma whilst they were a child or a young person. When children are between 5 and 10, so typically primary school age or elementary school, depending on where you're based, if you're online, it's the stereotypes around being socially inept, lacking friends, being abnormal, being stupid or unintelligent. And again, I think the importance here is thinking about the developmental age that children are going through and how that may well impact human development more generally, because children at that age, of course, are trying to make friends, they're meeting different people, they're developing their communication skills. They're speaking to children, adults, different people from different backgrounds, different ages, genders, ethnicities, and so forth. So these stereotypes are actually impacting human development. So I think that's critically important there. Teenage years, unhygienic, unattractive, sloppy, sexually undesirable. And when you look at some of the key literature around bullying and victimization, and there's some global studies that collect data on experiences of bullying and victimization in high and low and middle income countries, when they focus in on children within the higher weight ranges, often the most common experiences of bullying and victimization are related to being physically unattractive, being sexually undesirable. So those stereotypes are also coming out in terms of what children and young people are reporting. Then, of course, you're moving into burden, it's your fault. That's the transition, because, of course, stigma for children and young people, typically in the media, it's directed towards parents, and then there's a transition, of course, to the individual themselves as they move into early adulthood. So we see that in the literature. The one thing that I'll probably mention is that we've also seen a rise, a rapid increase in the amount of media portrayal of weight management related programs or weight loss programs. The biggest loser, of course, is one of the high profile ones that we've seen. From the very framing and the outset, the title itself, it's really influencing you in terms of your perceptions of the people who will be on that program. And there's been quite a lot of experimental studies that have looked at the biggest loser in particular, exposing people to that program. And they've shown that anti-fat attitudes increases when you're exposed to that program, that people believe that weight is more controllable, and importantly, that exposure leads to a reduction and an avoidance of physical activity and other health-related behaviors, including engaging in healthcare. So that's critically important. And if you're interested in that, there's a paper that was published last year by Nutter and Saunders at the bottom of my slide, a systematic review of the experimental research in that space if you want to find out more. So in terms of the media portrayal, what we've also shown is an ill alignment with the empirical evidence base. This is a study that I was fortunate enough to be a part of with colleagues at Lancaster. Professor Baker led this piece of work. And it was an analysis of UK press coverage of obesity over a 10-year period. So a massive amount of data, a corpus of 36 million instances of the words of obesity and weight-related language being used in that corpus. This, of course, isn't a holistic list. Some of the key findings that I wanted to highlight here is that, of course, we've seen an increase in the amount of coverage of obesity over that 10-year period. The media focus has shifted very much towards childhood obesity. And what I want to caveat here is that may well also be because of the greater focus, political focus on childhood obesity, and most likely around prevention, which we've seen with the current government here in the UK. That obesity is portrayed as simple, but increasingly presented as simple. And that, of course, smacks in the face of the evidence base. And this 10-year period is straight after what was the Foresight report, which you'll see, or the Foresight map on the right. I'll make the assumption that everybody here has seen this before, but we will be well versed that obesity, of course, is very complex. It's multi-level, it's multifaceted. It's certainly not simple. And as we've developed and published more evidence on the causes and consequences relating to obesity, we've really understood that it's more and more complex, but actually the media portrayal has done the opposite. It's told the public that it's more and more simple. So it's very much ill-aligned. As I mentioned, the focus is very much on individuals. So one, the causes of obesity are based on individuals, and the solutions to weight management or weight loss, again, is individuals, individual agency. And those media messages are really, in particular, again, quite insidious, and they're developed to really shame the people that they're presenting. So the use of emotive and evocative language is very evident throughout. And that's ultimately what grips people and engages them in these types of portrayals, because that's what, of course, media portrayal is about. How much can we engage the population with these different stories? I made the caveat, of course, that in some instances it may well be that media is reflecting political messaging and framing and so on. We can't get away from the fact in the UK that over time there's been increasing messages that individuals themselves are responsible. So, of course, one of the questions here might be, is it that media themselves are developing stigmatizing material? quite likely. But is it also that it's following the political messaging? And I would say that both are issues here. And of course, policies in this space have also become very much focused on individual blame, but most likely individuals changing their behaviors. So the focus on individual agency is a method of weight reduction. There's a nice study that was published by colleagues at Cambridge that highlighted that over a 28-year period, over 650 policies were put forward. 14 policies were actually enacted within a 28-year period relating to obesity, and they all had a focus on individual behavior change. The last thing I'll quickly say here, in relation to the media in particular, is the ill alignment then between policies that are coming out and media messaging. So the soft drinks industry levy, when that was launched, the day it was launched, the media actually, in many instances, were very critical of the policy. They said it was never going to work. They cherry-picked information from it. They said that different parts of the population were going to be disproportionately impacted. So those policies that are coming forward from government may well be impacted in terms of the likely public engagement, public knowledge of policies. The reality is that 99% of the population don't pick up a policy document to read the document. They rely on the media's reporting. So public understanding of policies, of course, is an issue here. And therefore may well impact, of course, the effectiveness of any policies that are published from a government perspective. So media are critically important. I'm not going to spend time on this slide, but I can't go past do this presentation without mentioning this. Not only are individuals stigmatized, but of course, certain types of interventions or treatments are stigmatized and stigmatized heavily. There is a lot of research that has shown that people are stigmatized who may well have different types of surgery, and those kind of stereotypes around that this form of treatment is a quick fix or an easy way out and so forth. That's been highlighted in the literature for some time. And actually then individuals who may well have lost weight, for instance, either via surgery or pharmacotherapy, again, they're perceived as being less valuable methods of weight loss compared to, for instance, people who lose weight through exercise and diet. That paper that on the bottom there, published by Lenny Vartanian in 2013, really highlighted that people value people who have lost weight through personal volition more than surgery or pharmacotherapy to a higher degree. And the last thing I'll quickly say, and I think this needs to be a real focus, it's certainly a focus for me right now, is the messaging and the misconceptions and stigma that actually is the unintended consequence here of the rapid rise in the amount of information relating to the new pharmacotherapy. And actually in many instances, even the descriptions of what these different medications are is very inaccurate. Again, you have different actors here. So, kind of minor celebrities and other people like Elon Musk who are, using these types of products and so on, and different messaging about why they might want to use it, again, will influence perceptions, misconceptions, and inevitably drive stigma. Moving on to the workplace. Again, there's a lot of research that highlights that workplace is where stigma plays out. Research has, for instance, demonstrated that in comparison to people who would fall within the healthy weight range, so healthy weight counterparts, that people living with obesity are perceived as having less leadership qualities. They receive a lower starting salary compared to people in a healthy weight range, even though they're performing exactly the same role. And that's some research that's come from colleagues in the US. That people living with obesity are expected to work longer hours. And ultimately, these types of experiences can lead to lower satisfaction within the workplace, more likely to leave, and therefore greater staff turnover, disengagement, and potentially also presenteeism and absenteeism in the workplace, which again should be quite understandable given that these types of experiences are extremely detrimental. I've got an example here on the left. I won't talk obviously too much to the relationship with healthcare because that's what Adrian's doing later. But for those of you who haven't come across this, on the left, this is Maggie de Block. She was the health minister for Belgium. She actually had two time points when she was the health minister, but the first instance was in 2013. And when she was announced as a health minister, she received massive criticism. The media were really negative. And of course, there was all the messaging about how could this person possibly be the health minister? She's a bad role model, etc., etc. And so she was criticized heavily. And actually, when you look at her background, her qualifications and so forth, there'd be nobody better to actually take on this role. But unfortunately, she was stigmatized heavily relating to obesity. And she's talked about these experiences as she's evolved in her political career. And she highlights that, of course, that when she walks into a room, she knows and she feels it, and people are judging her immediately as soon as she walks into that room. And so, for instance, if she had a different health condition that wasn't visible, of course, nobody would know that that she had that condition, or would potentially question her credibility to deliver that role. One quick slide, which is a paper that we published in 2016 looking at recruitment, because of course in the recruitment process people are stigmatized and may well be overlooked. And this was an experimental study that we conducted where we created a hypothetical job roles, so people who were involved in the recruitment of candidates that had a lot of experience of recruiting candidates to different types of roles that range from sedentary roles to heavy manual roles. They received person specification, job roles, all the other types of information you would expect. And then they were given CVs and applications from potential candidates. And the difference across these, and where we made it clear that people were applying who had a different weight status, was by utilizing a passport's picture that was accompanying the CV. So somebody in the healthy weight range, somebody living with obesity, and then a more of a control trial where there was no image presented. And what you can see here is that the suitability ratings for both males and females was dramatically lower for the person living with obesity. And the other key finding here is that females living with obesity were perceived as significantly less suitable compared to, for instance, males living with obesity. So the effect of stigma, and we see this across a lot of different papers and research, some of mine and other colleagues, that women living with obesity has a greater level of stigma compared to men living with obesity. So there is a gender effect. Just quickly on a couple of interventions and kind of ideas in terms of what we might be able to do. I think with the media, of course, there's a big issue here in terms of the portrayal. That portrayal leads to the formation of weight stigma attitudes, the maintenance of those attitudes. But I also think there's a solution, in terms of how we can start to address public misconceptions by improving the portrayal. Again, it goes back to the fact that it's so readily available and consistent, continuous messaging. If we can improve media portrayal of obesity, I think it can go some way to supporting our efforts to reduce stigma. And we've seen that actually in other areas in the past. For instance, HIV/AIDS has been heavily stigmatized. Media were very key in terms of starting to reduce stigma towards people living with HIV by educating people that HIV/AIDS is not just relating to sexual encounters, but may well be passed on at birth, or blood transfusions, rape, and so forth. So the media actually can be a key source to reduce stigma. We had a call in 2018 to the media to improve portrayal. That really focused around accuracy of reporting and respect within that reporting. I've got a question down the bottom here, which is, is it too much to ask that, we have accuracy in the reporting, particularly around something that is a health condition? I think it's something that we should be expected, and we of course would expect it in other areas, but actually, there's a lot of inaccurate reporting around obesity, and it kind of seems to fly without question. We need engagement from some of those professional societies, and what we've also highlighted, of course, is that in many instances, the ethical codes of journalists are not being adhered to. So, the groups like the National Union of Journalists, Society of Professional Journalists, and so forth, we need their engagement. Legislative action, of course, has been proposed. And again, I think this is a potential opportunity, whether it's on a national level or potentially around workplaces and workplace-based policies. There's a splattering of different legislations that have come in. You'll see down the bottom a couple of examples, one from the state of Michigan, and then also from the human rights policy for Reykjavik City in Iceland. What I want to highlight here in the Equality Act, which we utilize in the UK, if you take weight out of the equation and you really think about what these stigmatizing experiences represent, it's all of these above. It's direct and it's indirect discrimination. It's harassment, it's victimization. And the reality here is that weight, stigma, and discrimination reflects these. These are the experiences. We wouldn't accept people being victimized and harassed about other topics. But unfortunately, right now, we're still allowing weight, stigma, and discrimination to play out in society. Last slide again, I think there's a big focus here and a good opportunity for us to address and start to reduce stigma through improved training and education. We have seen some examples. I've been fortunate enough to be part of what is a weight stigma learning hub, which was launched by Public Health Scotland. That's actually available. People can access that. It's a great hub, and that's available for people to access and learn from. And we're hoping over time to evaluate the impact of that with healthcare professionals in particular. And then within the more recent Healthy Weight Coaches program that's available for frontline staff in the NHS, there's a designated module that is specific to addressing weight stigma, improving communication, and so forth. I think we can include it within equality and inclusion training. Again, that needs to be something that's not just a one training time point, but needs to be something that people come back to, just like training around other topics. And I also think that anybody who's working directly with people living with obesity, whether that's in weight management service or in healthcare, it actually should be a mandatory training piece, because we know that it may well be unintentional, of course, but unfortunately, stigmas that people hold do impact the care that's provided. So to very quickly summarize, I've talked about media, I've talked about workplaces, I've alluded to policy. I think if we're going to address weight stigma, it needs to be whole system from top to bottom. It needs to be policy, it needs to be in organizations, it needs to be with the individual. Media, of course, are a key contributor to stigma, but I also think they're part of the solution. And so, yes, we should, of course, be critical of media, but we also need to engage them and work with them to be able to address some of the stigma that's so often evident in society. We need to address the direct and indirect impacts of stigma in the workplace, but actually by doing so, not only will it be beneficial for the workplace itself, but it will also have wider benefits across society. Thank you very much.
Thank you very much, Stuart. So maybe just a very, very quick question, if there is one from the floor or from online. Otherwise, speak about this. There is one?
I'll do a very quick one.
Okay, very quick one.
So Benjamin Jewell has asked, he's interested in the creative and artistic aspect of the public narrative around obesity. So you've been talking about political and media, but the stories that we tell are by their very nature individualized and therefore tend to support rather than combat the stigma. Just wondered if you've got any reflections on that.
I didn't quite catch the question. Could you repeat it?
Sure. Just the fact that culture in sort of like the stories that we tell, so in the creative sphere, stories are by nature individualized, and wondered if there's any reflections on the idea that if you could change those or...
I'm not sure about changing individual stories relating to stigma. I think they're critically important. We need to understand individuals' stories relating to stigma, because if we're ever going to address stigma and potentially combat stigma that people are experiencing, we need to understand the breadth. And people will inevitably have different types of experiences. I mean, I've kind of alluded to some of that in my presentation. So I would actually say what we need to do more of is engage with people who have different types of stories to really understand the breadth of those stigmatizing experiences, so we can develop more effective interventions that are representative of the experiences of stigma.
And to bring them into the artistic sphere more, the cultural and artistic sphere.
For sure, yeah. Sure. And certainly the cultural and artistic, there's quite a bit of research that will show that stigma is very evident within that sphere as well.
Thank you.
Yeah. There's probably also linked to the drive for thinness and so on that is very evident within certain industries relating to the creative industries.
Okay, we will have an opportunity to go back to the issue of stigma in the media later today during the panel discussion. There was somebody who was asking if somebody representing the media would ever come to a meeting like this. And in fact, we have invited somebody with direct experience of media as a reporter. So we will have a chance to discuss this later on.